Another presentation brought to you by BGS Financial Services. Medicare is the basis of most retirees' post-retirement health insurance. In this video we will explain the basics of Medicare. What is Medicare? Medicare is a federal program that provides health insurance to retired individuals, regardless of their medical condition. Here are some basic facts about Medicare that you should know. What does Medicare cover? Medicare coverage consists of two main parts: Medicare Part A or hospital insurance, and Medicare Part B or medical insurance. A third part, Medicare Part C or Medicare Advantage, is a program that allows you to choose among several types of healthcare plans. The fourth part, Medicare Part D, offers prescription drug coverage that can help you handle the rising costs of prescriptions. Generally known as hospital insurance, Part A covers services associated with inpatient hospital care. These are the costs associated with an overnight stay in a hospital, skilled nursing facility, or psychiatric hospital, including charges for the hospital room, meals, and nursing services. Part A also covers hospice care and home health care. Generally known as medical insurance, Part B covers other medical care. Physician care, whether you received it as an inpatient at a hospital, as an outpatient at a hospital or other healthcare facility, or at a doctor's office, is covered under Part B. Laboratory tests, physical therapy or rehabilitation services, and ambulance service are also covered. The 1997 Balanced Budget Act expanded the kinds of private healthcare plans that may offer Medicare benefits to include managed care plans and private fee-for-service plans. Medicare Part C programs are in addition to the fee-for-service options available under Medicare Parts A and B. Medicare Part C programs vary, but generally provide all Medicare-covered benefits. Many also offer extra benefits, including prescription drug coverage, and coverage for additional days in the hospital. Now let's talk about the prescription drug plan, also known as Medicare Part D. All Medicare beneficiaries are eligible to join the Medicare prescription drug plan offered by private companies or insurers that have been approved by Medicare. Although these plans vary in price and benefits, they all cover a broad number of brand name and generic drugs available at local pharmacies or through the mail. Medicare prescription drug coverage is voluntary, but if you decide to join the plan, keep in mind that some plans cover more drugs or offer a wider selection of pharmacies for a higher premium than others. You can get information and help with comparing plans on the Medicare website, www.medicare.gov, or by calling the Medicare counselor at 1-800-MEDICARE. What is not covered by Medicare Parts A and B? Some medical expenses are not covered by either Part A or B. These expenses include your Part B premium, deductibles, coinsurance, or co-payments that apply most prescription drugs, dental care, hearing aids, eye care, custodial care at home or in a nursing home. Medicare Part C may cover some of these expenses, or you can purchase the supplemental Medigap insurance policy that will help cover what Medicare does not. Are you eligible for Medicare? Most people age 65 or older who are citizens or permanent residents of the United States are eligible for Medicare Part A, known as hospital insurance, without paying a monthly premium. You are eligible at age 65 if you receive or are eligible to receive Social Security or Railroad Retirement Board benefits based on your own work record or on someone else's work record as a spouse, divorced spouse, widow, widowed, divorced widow, divorced widowed, your parent, you or your spouse worked long enough in a government job where Medicare taxes were paid. Here are some additional requirements. In addition, if you are under age 65, you can get Part A without paying a monthly premium if you have received Social Security or Railroad Retirement Board disability benefits for 24 months, or if you are on kidney dialysis or are a kidney transplant patient. Even if you're not eligible for free Part A coverage, you may still be able to purchase it by paying the premium. Call the Social Security Administration at 800-772-1213 for more information. Although Medicare Part B, or medical insurance, is optional, most people sign up for it. If you want to join the Medicare Managed Care Plan or a Medicare Private Fee-for-Service Plan, you'll need to enroll in both Parts A and B. And Medicare Part B is never free. You'll pay a monthly premium for it, even if you are eligible for premium-free Medicare Part A. How much does Medicare cost? Medicare deductible amounts and premiums change annually. Here's what you'll pay for Medicare in 2010. In Part A, most people will pay no premium, but non-eligible individuals pay either $254 per month if they have 30 to 39 quarters of Medicare-covered employment, or $461 per month if they have 29 or fewer quarters of Medicare-covered employment. They will have a $1,100 deductible per benefit period. Lastly, they will be responsible for $275 a day for the 61st to 90th day each benefit period, $550 a day for the 91st to 150th day for each lifetime reserve day for a total of 60 lifetime reserve days, up to $137.50 a day for the 21st to 100th day each benefit period for skilled nursing facility care. In Part B, most members will pay $96.40 per month. Most people will pay this premium, but certain beneficiaries will pay more. See notes on next slide for explanation. The Part B deductible is $155 per year. After satisfying a deductible, you normally pay 20% of the approved amount for medical expenses, 50% for outpatient mental health services, 20% for hospital charges for outpatient hospital services, and nothing for laboratory services. Notes: your monthly Medicare Part B premium will be $110.50 if you did not have the Social Security Administration withhold your premium in 2009. You will pay an even higher premium if you file an individual income tax return and your annual modified adjusted gross income is more than $85,000, or if you file a joint income tax return and your annual modified adjusted gross income is more than $170,000 in 2010. For more information, visit www.medicare.gov. Since Medicare doesn't cover every type of medical care, and you'll have to pay deductibles and coinsurance, you may want to buy the Medicare Supplemental Insurance Policy, also known as Medigap. Who administers the Medicare program? The Centers for Medicare and Medicaid Services, formerly known as the Healthcare Financing Administration, a division of the U.S. Department of Health and Human Services, has overall responsibility for administering the Medicare program and sets standards and policies. Social Security Administration, or the SSA for short, handles all the processing of Medicare applications and answers questions about eligibility. However, as a beneficiary, you deal mostly with the private insurance companies that actually handle the claims on the local level for individuals with Medicare coverage. Insurance companies that handle Medicare Part A claims are known as Medicare intermediaries, and insurance companies that handle Part B claims are known as Medicare carriers. Managed care plans handle Part C claims. Although the same private insurance company may handle both Part A and Part B claims, Part A and Part B are very different in regard to administration. For example, different deductibles and co-payment requirements. There is virtually no overlap. It is as if you have two separate health insurance policies. How do you sign up for Medicare? Any individual who is receiving Social Security benefits will automatically be enrolled in Medicare Parts A and B at age 65 when he or she becomes eligible. If you are not receiving Social Security benefits before age 65, you will be automatically enrolled when you apply for benefits at age 65. But if you decide to delay retirement until after age 65, remember to enroll in Medicare Parts A and B at age 65 anyway, because your enrollment won't be automatic. If you're going to be automatically enrolled in Medicare, you'll receive an initial enrollment package by mail from the Social Security Administration, usually 3 months before your 65th birthday. Of course, even if you sign up for Part A, you don't have to enroll in Part B, or you can decide to delay enrolling. But first, carefully read the information contained in your initial enrollment package. It explains the consequences of not enrolling at age 65. For example, you may have to pay a higher premium later. It will also help you learn more about the Medicare program. We would like to thank you for taking the time to learn the basics of Medicare. For more information about enrolling in Medicare, call the Social Security Administration at 800-772-1213. For information or questions about this or any other insurance or investment-related product or service, please feel free to call Ben at BGS Financial Services. Our number is area code 561910608. You can find us on the web at www.bgsfinancialservices.com or email us at bstill@bgsfinancialservices.com. Please remember not to keep us a secret. Share this and our other videos with your friend and family.